Welcome to the deep dive. We're taking a fascinating plunge today, right into the world of language and communication disorders.
Hmm.
Now, whether you're maybe a pediatrician, a physician, or perhaps a parent just trying to understand, what you're seeing in your child, or really just anyone curious about how we connect this deep dive is, well, it's for you.
Yeah,
We're aiming to unpack this whole area, make it clear, engaging, without getting totally bogged down in jargon.
exactly. Because communication, it's just so fundamental, isn't it?
It really is.
And when things aren't smooth, it can really affect someone's life, their family's life too.
Right.
So the idea is to give everyone a solid grasp of what these challenges look like, maybe what's behind them, and offer some useful insights.
So when we talk about communication disorders, what does that really mean for someone listening?
Well, fundamentally, it's about difficulty with any part of that information exchange.
Yeah.
So could be trouble taking information and expressing yourself, making sense of things, even understanding like nonverbal stuff or symbols. It's a really broad term.
It sounds it.
Yeah, it can affect hearing, language, speech, sometimes all three together.
And why should this be on our radar? Whether you're in the medical field or just a parent.
Well, for clinicians, especially in primary care, getting a real feel for communication development gives a richer picture of a child's overall health,
Hmm.
you know, beyond just the medical chart.
That makes sense.
And for parents, gosh, it can provide crucial insights into things they might be noticing, help them figure out what support might be needed, what resources are out there. It's about understanding, really, and advocating.
Okay, so for this deep dive, what's our roadmap? What are we covering?
Right. So we'll start by trying to clearly separate speech disorders from language disorders. They often get lumped together.
Good starting point.
Then we'll look at some interesting links researchers are finding, like the whole screen time thing and language development.
Ah, yes. The big one.
Yeah. We'll touch on how common these are, maybe some risk factors. Then walk through typical language milestones, what you generally expect to see.
Go.
Tackle that common question about bilingualism causing delays.
Hmm.
Spoiler, it generally doesn't on its own.
Good to clarify.
And then dig into the different types: language impairment, ASD-related communication issues, fluency disorders like stuttering, and finally, wrap up with ways to support kids.
Sounds like a really solid plan. Will give people a great foundation. So let's jump in. Basics first. Speech versus language disorders. What's the key difference people need to grasp?
Yeah, that's crucial. Think of speech as the mechanics of talking, producing the sounds.
The physical act.
Exactly. So speech disorders are about hiccups in actually making those sounds.
Hmm.
You might hear kids repeating sounds or whole words,
Like,
right? Or go, go, go,
right.
or maybe struggling with certain sounds even though they know the word, stretching sounds out like
Right.
snake. Sometimes even noticeable physical things while talking: head jerks, lots of blinking, pausing a lot, like they're stuck.
Okay, that paints a clear picture for speech issues. So then, language disorders.
Yeah.
How are they different?
Language disorders are more about the system understanding and using the words, the grammar, the meaning.
The content, not just the delivery.
Precisely.
Mm.
It's about grasping what others mean and being able to get your own thoughts and ideas across effectively.
So what might that look like?
Well, you might see someone using lots of fillers, like
Mm.
because they can't quite retrieve the word they want.
Okay.
Maybe a smaller vocabulary than their peers, trouble understanding new ideas or words, difficulty putting sentences together logically.
Words in the wrong order, maybe?
Exactly. Or struggling to follow directions, answer questions properly. So yeah, speech is the how, language is the what and why of communication.
That really clarifies it. Something you mentioned, and it comes up constantly, screen time. What did our sources suggest about its connection to language development in kids?
Right, this is a huge topic. We looked at a large survey focused on toddlers, like 2 to 3-year-olds, and their mobile device use.
And what did it find?
Well, it found an association, important word there, association, not necessarily direct causation, proved in this one study between more screen time and poorer language skills,
Mm.
both understanding language and actually expressing themselves.
That sounds concerning for parents of little ones. Was there like a specific amount of screen time that stood out?
Yeah, the study suggested a higher risk of difficulties when titers were getting more than 2 hours of mobile device time per day.
2 hours. Okay.
Definitely something to be mindful of.
It is. But, I feel like the research on this can sometimes seem contradictory. Did the material address why that might be?
It did, yeah. It highlights that findings aren't always consistent. And a big part of that is likely how different studies measure things.
Wow, so.
Like what counts as screen time? Phones, tablets, TV, how long, what kind of content? And then how are they measuring language? It's not always comparing the same things.
So it's not just a simple screen's bad, no screen's good situation.
Definitely not. The type of content seems to matter. Educational stuff, especially if a parent is watching with the child.
Co-viewing.
Exactly.
Yeah.
Interacting, explaining, connecting it to their world that can actually have small positive effects, especially for slightly older toddlers, maybe 3 and up.
Okay, that's an important nuance.
But here's a key takeaway. Just having the TV on in the background, even if the child isn't glued to it, that can negatively impact their language use.
Really? How does that work? Seems passive.
It does, but think about the environment.
Hmm.
One study found that when the TV's on, adults tend to talk less, significantly less.
Oh, wow.
Yeah, like maybe 500 to 1,000 fewer words exchanged with the child during that time. And those interactions are gold for language learning. The background noise kind of dampens the whole language environment.
That's a really powerful point. It's not just about active watching, but the whole home communication dynamic.
Precisely. And family interaction around screens can be a buffer. If you're engaged, talking about it, asking questions.
Making it active.
Right. It can lessen potential downsides.
Yeah.
But interestingly, the sources specifically flagged TV during mealtimes as negatively linked with expressive language. Those mealtime chats seem pretty important.
Good to know. Okay, shifting gears slightly. How common are these speech and language delays? And what factors might increase the risk?
Okay, so we looked at a study from a pediatric outpatient department. It explored a whole range of potential risk factors in kids aged 1 to 12.
Right.
Now, it's hospital-based, so maybe not perfectly representative of all kids, but it gives us a window into what researchers look at.
And why is understanding these risk factors useful for, say, a family doctor or a parent?
Because catching things early makes a huge difference. Early identification, early support.
Intervention is key.
Absolutely.
Yeah.
So knowing potential risk factors helps everyone docs, parents be more attuned to early signs and get help sooner if it's needed.
Makes sense. But you mentioned the limitation of it being hospital-based. What should we keep in mind there?
Just that hospital studies might see more kids who already have some health or developmental stuff going on. So the frequency of risk factors found there might be higher than the general population. We still need those big, broad population studies for the full picture.
Gotcha. So to give listeners some context for all this, what does typical language development look like in those early years? What are some general milestones?
Yeah, good idea. So very broadly, first words often pop up around age 1.
Okay.
Between 1 and 2, vocabulary usually explodes, often over 50 words.
Yeah.
And they start stringing 2 words together. More milk. Daddy go.
Simple phrases.
Right. Then around 2, you see more grammar kicking in, following simple commands using enging endings, plurals with mess.
Like dogs barking.
Exactly. By 3, sentences get longer, maybe 3, 4, 5 words, more complex grammar. And by 4 or 5, many kids sound quite adult-like grammatically, can hold longer conversations, tell simple stories.
Well, we're useful benchmarks, but I guess there's variation, right? It's not rigid.
Oh, absolutely. Huge variation is normal. These are just general guidelines. Some kids are earlier, some later. Still totally typical. And importantly, if a child is learning more than one language,
Bilingualism.
right, their timeline might look a bit different for each language, but their overall total language development across both should generally be on track.
That leads perfectly into that big question. Does being bilingual cause language delays?
That's such a common worry. But the sources are pretty clear. No. Learning 2 languages is typical development. It's not a reason for a delay if you look at the child's skills across both languages.
So a child might know fewer words in English than a monolingual English speaker, but when you add their Spanish words, their total vocabulary is fine.
Exactly. Their overall conceptual vocabulary is usually age appropriate. They might mix grammar sometimes. That's normal too. It's part of the process.
So parents raising bilingual kids shouldn't hold back.
Definitely not. In fact, research shows even kids with developmental disorders can often successfully become bilingual. The key is, if you do have concerns, make sure the evaluation looks at all their languages. A delay showing up in both languages needs attention.
Okay, that's really helpful clarification. So we've covered typical development, screens, bilingualism. Let's dive into the different types of disorders. Where do we start?
We can start with what are sometimes called isolated language disorders.
Mm,
You might also hear them called language impairment, or more recently, developmental language disorder, or DLD.
okay. What defines those?
These are significant problems with understanding or using language, but without other major issues causing it, like serious cognitive impairment, hearing loss, motor problems. It's primarily about the language itself. Diagnosis often involves standardized tests where scores are significantly below average for their age.
And what might you notice in a child with DLD?
Well, while many learn to communicate well, some persistent, maybe subtle difficulties can remain. Their stories might be shorter, less complex. They might struggle with higher level language, like reasoning, seeing another's perspective, paraphrasing. And because social interaction leans so heavily on language, sometimes social challenges can arise too.
Then there's autism spectrum disorder, ASD. Communication is central there, right? But it looks different.
Yes, communication differences are a core feature of ASD, but it's incredibly varied. You have individuals who might be nonverbal, others who are highly verbal with huge
By
vocabularies.
real spectrum.
Absolutely. But even for those who are very verbal, there are often challenges with the social use of language pragmatics, understanding cues, turn-taking, adapting language to the situation.
Okay.
And our sources also mentioned autistic regression, where some children, usually between 1 and 3, might lose language or social skills they previously had.
And there's another one, sounds related but distinct. Social pragmatic communication disorder, SPCD. How's that different from ASD?
Good question. SPCD is specifically about difficulties in the social use of communication, both verbal and nonverbal. Things like greeting people, sharing information appropriately, changing how you talk depending on who you're with, following conversation rules, understanding humor or metaphors.
Non-literal stuff.
Exactly. The key difference from ASD is that individuals with SPCD generally don't have those restricted, repetitive behaviors or intense, narrow interests typical of autism. The challenge is primarily in social communication itself.
Okay, that distinction is helpful. We should also cover fluency disorders, what most people call stuttering. The terminology's changed slightly.
Yeah, the official diagnostic term now is childhood onset fluency disorder. But yes, it's what we typically think of as stuttering. It's about disruptions in the flow of speech.
What kind of disruptions?
Things like repeating sounds or syllables with plink, prolonging sounds, mummy, pauses or breaks within words, pop, 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 scat, blocks, where no sound comes out but they're trying.
Feeling stuck.
Right. Or using extra words to get around a tricky word. Noticeable physical tension, repeating whole single-syllable words like go, go, go.
That sounds definitely different from just, the normal ums and undas everyone uses.
It is. While almost all young kids go through a phase of being a bit disfluent, stuttering is usually more frequent, more noticeable, and often comes with effort or tension. It can also cause anxiety about talking, affect participation,
When does it typically start?
usually between 2 and 4 years old. A lot of kids recover spontaneously, but not all. It's important to know when it might be more than typical disfluency and might need checking out by a speech-language pathologist and SLP.
So what are the signs that suggest it might be stuttering and not just typical toddler talk?
Things like how often it happens, maybe more than 3 disfluencies per 100 syllables. If you see those associated physical things, blinking, tapping. If the child seems bothered or avoids talking. Family history matters too. Generally, if it persists past age 4, an evaluation is a good idea.
Okay. This has been a fantastic overview of the different types. Let's switch to support. What can parents or caregivers do, just generally, to foster good language development? Oh, so much in everyday life. Talk to your child right from the start. Use varied language, ask questions, and really listen to their answers, even if they're jumbled.
Engage with them.
Yes. Narrate what you're doing. Talk about feelings. Read books together. Sing songs. Be responsive. Imitate their sounds. Follow their interests. Provide that warm, encouraging environment where they feel safe to try.
That sounds crucial. Now, what about specific issues? Our sources linked writing problems sometimes to language disorders. What can help if a child struggles with writing?
That's a great point. Writing is complex. It needs transcription skills, handwriting, spelling. It needs executive functions planning, organizing, working memory, and yes, underlying language skills.
So a breakdown anywhere affects the writing.
Exactly. If handwriting is a huge effort, dysgraphia, there's less mental space for ideas. If language is weak, expressing complex thoughts on paper is hard.
So what helps? Are there effective strategies?
It depends on the issue. For transcription problems, explicit practice to make handwriting and spelling more automatic is key. Connect it to real writing tasks. Okay.
For organizing thoughts, Teaching specific writing strategies works well. Things like planning frameworks, outlining techniques. There's a method called self-regulated strategy development, SRSD, that's shown good results teaching kids steps to plan, draft, revise, and monitor their writing.
And what about tech? Speech to text, things like that?
Yeah, assistive technology can be a game changer for some kids. Speech to text can bypass handwriting struggles, let them focus on ideas.
But it's not magic.
No. Crucially, they need to be taught how to use it effectively as a tool for writing, not just given a software. Instruction is key.
Right. And finally, let's loop back to stuttering. If a child does need therapy, what does that generally involve?
Well, while it can be lifelong for some, therapy, especially early on in preschool, can really help improve fluency and confidence.
What kind of therapy?
It varies. There are less direct approaches focused on modifying the environment, slowing down speech rate around the child, reducing pressure, and more direct therapy, working with the child on awareness of their speech, learning fluency-shaping techniques, managing anxiety around talking. The approach depends on the child's age, needs, and how stuttering impacts them.
This has been incredibly thorough. Such a helpful deep dive. To wrap it up, what are the absolute key takeaways for our listeners?
Okay, I'd say 1, communication disorders are diverse. They hit speech, language, or both in many ways. 2, early awareness is vital. Pay attention to milestones, and factors like screen time do warrant consideration.
Right.
3, remember bilingualism isn't the enemy. Evaluate skills across all languages if concerned. 4, there are distinct types: DLD, ASD communication features, SBCD, stuttering, understand the differences. And 5, perhaps most importantly, effective support and interventions are available.
And for everyone listening, whether you're a pediatrician, physician, parent, or just interested, we really hope this gave you a clear, useful foundation.
Absolutely. And it makes you think, doesn't it? Given how tied communication is to everything social, emotional, cognitive growth.
Yeah.
Well, it poses a big question. What are the most crucial early steps we can all prioritize to ensure every child gets the strongest possible start in communication? Something to ponder. And definitely check out resources from places like ASHOR, the American Speech Language Hearing Association, or the CDC for more info.